Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And today's Labor Day here in the US, where generally people would be off from work. So I guess a lot of people are off from work because so many people are working from home. So likely enjoying the holiday with friends and our family and or in social isolation. So it's kind of a bittersweet day for me here today. So you can see the beautiful downtown right there. You can see the beautiful sunrise here. From the lake. So it's kind of a bittersweet day, as I mentioned, because today Janice and I are actually leaving Chicago, downtown South Side. We've lived down here for 16 years now. We're leaving. So I wanted to come out here one final time to watch the sunrise here on the south side of Chicago. So it's been kind of a weird sort of scenario and time for us here. You know, obviously I met my wife in Chicago. We started our business in Chicago. Lots of great friends and family, and we're going to keep our business in Chicago, but we are moving out for a variety of reasons, including the violence on the south side. It is real. What you see on TV and what you hear, depending on where you're watching your news, it is true. My wife has been held up by children with guns. We've been victims of our property being damaged and living next to criminals and drug dealers. And like I said, there's a lot of great people, a lot of great things about Chicago. However, it's time for us to move on. So having said that, my friend, as I mentioned to you a few weeks ago, called me up on a Sunday morning, and he's like, I'm struggling with my business, and he's dealing with his own issues and around his business, serving his clients. So and I remember thinking to myself as he was talking, like my heart actually hurt for him, and I felt his pain, I felt his frustration, I felt his anxiety, because we feel all the same things. So one of the things that we've talked about many times here on Facebook Live is just taking control of the things that you can control, right? So if you don't like your scenario, you change it. If you don't like what's happening in your world, your business, change what you can control. The couple things that you can control. There's not much you can control in the world. You can't control the media, you can't control the weather, you can't control politicians, you can't control, a lot of times what's happening in your community, but you can change a couple things. Number one is your mindset about what is happening in the world, and take control of the things that you have control over. Like I said, like your mindset, how you think about what's happening to you and your world, and how you present yourself to the world. So, one of the things that, my buddy said, he's like, sometimes I just struggle to get up in front of my clients and to lead and serve. And the thing about a leader is, I'm sure you've heard this quote, and don't know the exact quote, but it's something about like, it's not the good times that define the leaders. It's what happens during the challenging times, when there's lots of obstacles and things going on that are outside of your control. And one of the things that I really got from the book, Make Your Bed, I forget the admiral's name, he's a former Navy SEAL. He talked about the one thing the military teaches you is to make your bed and to shine your shoes. And it's not so that you always have a clean bed and you always have shiny shoes. It's because with all the chaos that goes on in battle and war, if you, in your world, so to speak, if you can control those things, like making your bed, like shining your shoes, like taking control of your own household or your own business, what are some things that you can do inside your business that actually you can control and actually improve upon? Like one of the things that Janice and I have really committed to during this time of COVID is, even though our business is down and we've struggled financially, and it's making sure that we stay mentally strong, because obviously we have the same anxiety and fear and worry and we don't know what the future is going to bring. We want to control the things that we can control. So what are some things in our business that we can actually clean up and improve? What are some systems that we need to improve? What are some things that we haven't done that we can actually work on and improve? So, I would encourage you, especially now that we're moving into like the last 4 months of the year, again, there's a lot of uncertainty out there. What are some of the things that you can control in your own life, in your own business? And one of the things that we've always tried to do, and again, I've failed as many people do, is what I've really tried to do is present a consistent message and a positive message for our community. So I want to thank you again for being part of our community. I want to thank you for what you do for your own community, whether it be your family, your clients, your patients, maybe your maybe you're a direct community, maybe you're out there volunteering. I know a lot of people are doing some wonderful things during this time to get out there and help and serve others. So thank you for that. And that's one of the things that we can continue to do, is serve others who need us. And that's what we want to do here. And that's why we do so many Facebook posts. That's why we put out so much free information, especially during COVID. We put out even more information because we want to serve you as health and fitness professionals, to empower you. So one of the things we've been talking about, besides leaving Chicago, is we've been talking about some of the upcoming events we have this fall, because, we were supposed to be in Fitness Fest earlier this year. So we got that coming up live here in a few weeks. I just spoke at Idea World Virtual, which was an amazing event online. So I was supposed to be speaking out there in California. So again, that was virtual. We've got our own certifications coming up. My buddy Robert and I are going to do an arthritis training solution coming up here in a month or so. Joining FAI, my friends over at FAI, for their first ever functional rehab online summit. So lots of great opportunities for you to learn, up-level your education, and to continue to be that strong leader, that consistent leader for your community. As we've been talking in this last few series, this is actually part 5. I just want to shoot this out here because I'm like, it's beautiful. It's going to be my last day out here, so let me take advantage of this beautiful weather, this last unofficial day, I should say, of summer, and talk about balance. One of the things we've been talking about over the last few weeks, as far as it relates to balance, is the importance of the foot tripod, getting that foot in contact with the ground so that your brain, your nervous system, is receiving accurate information about where the foot is on the ground and how the body is loading over top of your base of support, which is your foot and or feet. Thank you so much for being on. Carrie. Oh, hey, Carrie, how are you? Good friend, actually one of my wife's dear friends, Carrie. We also talked about the knee. The knee is a big shock absorber for the body, and the knee will also help put the foot where it belongs. So, a lot of our clients, our older clients, when they lose balance, they'll start to they'll rotate that tibia out. So they start to get that rotation of their knee, because remember, the knee isn't a purely hinge joint. It has a lot of rotation component to it, or a major rotation component to it. So we have to respect that. And a lot of our clients that start to lose the ability to rotate as they walk, they will start to waddle. We call it a waddling gait, unofficial term. However, what they will do is then they'll rotate the tibia out so that they have a wider base of support. So that will start to impact their knees, and they won't shock absorb as well, and they will start to tear up their knees. And then yesterday I talked about the hip, how to release the hamstrings, because how do the hamstrings relate to balance? Well, the hamstrings are very important for the gait cycle as you're walking, because as you move on to single leg stance, which is a part of walking and obviously a complete part of running, your hamstrings must activate to pull on the sacrotuberous ligament, which actually pulls on the sacroiliac joint ligaments, which helps to stabilize the sacroiliac joint and pelvis as you get into single leg. Well, many of our older clients do not have adequate or optimal hamstring length. So what happens is, as they get into single leg stance, the hamstrings are overactive and they will pull that pelvis into posterior pelvic tilt. What that actually does is it unlocks your SI joint at a point in the gait cycle when you stand on single leg where the SI joint should be locked, so that way you can support yourself in single leg stance. So again, that will also lead to this sort of weeble wobble type gait, because if your SI joint is not locked when you get into single leg stance, you will start to shift your weight to try to get more stability. So all these things that we've been sharing with you are strategies to improve your client's balance. Now, finally, I want to talk about step-ups. Step-ups are one of the best patterns you can do with your clients. However, many of your clients, especially your older clients, they have knee problems. So, step-ups are not a great pattern. However, there's several common reasons why your clients have issues with step-ups. Number one, they're using a step that's way too high. I'm going to use a step that's way too high for me. However, is what I got right here in the leg front. So I'm going to show you and demonstrate how to set your client up. And I'm going to encourage you to use a much lower step, because you need to be able to position your body weight over top your foot. And if the step's too high, you can't do that, and then your client will have to compensate. Now, the other thing that clients will do is they're thrusting off their back leg instead of keeping their weight over their forward leg and being able to use their glutes and posterior chain to drive themselves up and to control the eccentric phase. I talked about that in the last couple of videos, especially yesterday's Facebook Live, where I talked about the importance of the posterior chain is really eccentric control. Like, our industry teaches so much concentric, squeeze, tighten, make your tushy as tight as possible. That's actually the exact wrong thing you should be doing for your clients, or the exact opposite thing, I should say, for your clients, because that will just create more posterior pelvic tilt. That will create more femoral compression, femoral head compression in the acetabulum. So it's not a great strategy, and it's also a strategy that's leading to increased labral tears, femoral acetabular impingement, as well as early joint degeneration that we see in our clients. Even clients as young as 40 and early 50s are getting joint replacements because they're tearing their joints up from non-optimal strategies. So how can step-ups help you? Well, first, you must be able to do a split squat and a reverse lunge appropriately. So again, it's the same concepts that we've talked about. I'll step back here for a little bit here. So what we want to do is align the head and neck and thoracolpelvic cylinder. You want to be able to align over top the forward leg. So you want to make sure you're aligned and put your weight over top your forward leg and then step back. So the weight is primarily here, and then the first motion during a split squat is anterior pelvic rotation. So it's rotation of the entire cylinder so that you can load up that posterior hip complex, that glute, hamstring, and external hip rotators. Because the split squat then becomes the reverse lunge. So your reverse lunge looks exactly the same. So you align, and then you reverse lunge, and then come back up. You reverse lunge, again, getting that anterior pelvic rotation. And again, remember I talked about yesterday on Facebook Live post, I'm gonna turn around here in a moment, that the pelvis must stay level. So when you're here, let me turn around a little bit, the pelvis should stay level. So when you're here, the pelvis should be level. You do not want to see your client do this right here, that right there, because that's what a lot of your clients will do, which will then lead to why they're getting so many knee problems. The more your pelvis goes this way, the more you overload your knee and or you overload your back on that side. And that's why step-ups and lunges and those type of patterns hurt your clients' knees and or low back. Because if your client can't do split squats appropriately, they can't do reverse lunge, they should not be doing step-ups, because step-ups are just a more challenging version of that. I'm gonna step away and demonstrate what that looks like when you do it well. But again, remember I said, this is a little bit of a high surface even for me, but remember, a lot of your clients are doing, actually not your clients, but the industry's clients are doing a lot of this stuff because they wanna feel their glutes more. If you set your client up, your clients will feel their glutes more. So again, you'll see me align my head and neck, thoracolpelvic cylinder. I'm going to hinge over top of my forward leg and keep my weight primarily on my forward leg and use that forward leg to drive me up and to control the eccentric on the way down. Let me just step away from the camera. I'll show you what that looks like. So that was a forward lunge. You notice how I kept my weight over top the forward leg. I didn't land and crash on the back leg. I didn't lose control of my thoracolpelvic cylinder. So I'll show you it from behind as well. So you can do a lateral step up, same idea. Make sure you align the head and neck and thoracolpelvic cylinder. Make sure you get the anterior pelvic rotation and watch my pelvis. I'm gonna try to keep it the best level, the best that I can, but remember this is a little bit of a high surface for me. But again, when you're choosing the right height, you gotta make sure that your client sets up right. If they can't set up right, they're not gonna perform the pattern right. So let me just demonstrate that real quick. And when you do that, when you use a lower step than I'm using right here, and you really teach your client the fundamentals start with the setup. Align that head and neck, align the thoracolpelvic cylinder, align the pelvis, make sure your client gets rotation of the entire thoracolpelvic cylinder over top the forward hip. You really load that posterior chain, you take stress off the knees, off the low back, and even your clients, many of our clients that have degenerative joint disease in their hip and or knees, they're like, oh my God, that actually doesn't hurt my knees. Not every client can do this because their degeneration is more advanced. However, many of our clients can successfully do squatting or lunging because you've taught them a strategy. You've given them a strategy for improving their alignment and, more importantly, their control in these positions and being able to use their glutes, use that posterior chain to control their body weight, as well as also to control what's happening down through the hip, knee, ankle, and foot complex. And that's ultimately how you become the specialist for your current clients, how you attract more individuals that will actually need, want, and will pay you for your expertise. And this is exactly what we'll be teaching in our one-day conference on, I don't know the date, it's coming up here in a few weeks at Fitness Fest. Our pre-con one day is all about these strategies. How do you improve the lower extremity? How do you assess to determine your clients' suboptimal habits, the reasons why your clients are experiencing chronic tightness, discomfort, and can't do many of the things they need to and or want to do or even love to do? Then how do you use your corrective exercise? We'll take you through the integrated movement system corrective exercise strategy to help you develop more optimal posture and movement habits. And then we'll show you how to progress your client, how to squat, how to lunge, how to hip hinge, how to bend, do deadlift type patterns, how to choose the right exercises, as well as the most appropriate exercise progressions for your client, regardless of whether they have hip and or knee osteoarthritis, whether they have foot issues, whether they have their post-joint replacements. We'll give you strategies that you can use right away. We'll give you the same things that we use and we teach in our most advanced certification course, the Integrated Movement Specialist certification course. So that way you leave this one-day intensive with the strategies to dramatically change your clients' lives. Because like I said, when you have a client like my client Joel, who he was at a risk of falling, he actually fell down the stairs, and he's been doing virtual training with me for the last 4 months. We were doing live, and then it's been all virtual. He's actually improved his glute strength. His wife is like, his legs are rock solid. 84 years old. She's like, his legs are rock solid now. His balance so much better. He's able to pick up his legs because we've been doing drills, the same drills that I've been sharing with you, and that we'll share with you even further in our one-day conference. So, like I said, you can truly change people's lives, even your older clients that are stuck in quarantine right now, like so many of our clients are. And this is so important for them because many of our older clients, older population, I should say, their health is deteriorating. They're so afraid of COVID, and I'm not saying they shouldn't be afraid, but they're so locked in, they're not moving. Like my client Joel, he's literally left his house in 4 months twice. One for a drive, once to walk around the block. That's it, 4 months. So he's not doing the physical activity outside that he once did. But again, he's training with me 3 times a week online, and he is consistent. I should say his wife makes him consistent, but he's consistent, and he trains hard. Like we train him safely, and we train him pretty good. So that way, he has an improved quality of life, even though he has been in quarantine. And again, I know you're doing a lot of the same things with your clients, and we're going to share these exact strategies with you so you can continue to empower your clients, and we'll share with you how to communicate the importance of this with your clients. So that way, your clients understand that online can be equally as valuable as training in person. So thanks so much for all you do. I know this is kind of a long post. I want to thank you guys for all you do for your community. Thank you for allowing us to be part of your community. Let's go out there and make a difference. Let's be those leaders that our clients need. Let's be the leaders that bring our clients and our communities together and not be divisive like so many of our leaders tend to be these days. And let's spread love. Let's spread peace. Let's spread ability. Like allow our clients, empower our clients to be proactive, because this is a great opportunity. COVID is a great opportunity to be proactive about one's health and take control of those things, your mindset and your actions, and truly come out of this stronger, more resilient, and a more loving society. So thanks for everything. Take care. We'll see you next time. I'll be coming to you next time, probably from Wisconsin in our new home. So if you're in Chicago, we'll see you soon, and have a great day. Thanks, guys.